Joining me now, Dr. Tom Price. He's an orthopedic surgeon, knows something about a small business. He built his business from scratch over a long period of time and worked on my oldest son, Jack, that had some back ailments when he was playing basketball. Most recently served as the 23rd Secretary of the HHS, the Health and Human Services cabinet member there in the Trump administration. He brought to the department a lifetime of service and a dedication to advancing the quality of health care in America, both as a physician and a policymaker. Also of note, Tom Price was my congressman when I lived in Georgia for a quarter century, and he was my congressman in the 6th District after Newt Gingrich retired from there as Speaker, and he was also chairman of the Republican Study Committee. He was in leadership, a great friend of mine for a very long time. Dr. Price, great to have you back on the show, sir.
Hey, John, thanks so much. What a great joy it is to be back with you, and I apologize for not being able to make it last week.
Oh, that's okay. There's no worries at all, and I got to catch up on the phone. But I talked to your wife, Betty, for about an hour and a half while I was driving down to Georgia, so I got all the scoop on your son and all that. Your family, I heard your son's getting married. I'm not sure you want to publish that, but people are going to want to go to the wedding, right?
We'll leave that for him to publicize, but an exciting day coming up this fall.
All right, good deal. All right, I want to talk about, you're a doctor, but unique. You served in Congress, and you're also a small business owner, right? I mean, you basically started your orthopedic practice one guy, and you turned it into a pretty big company when you started. What do you say to small business owners now that in Georgia, Mississippi, Tennessee, where I'll be, they just want to get back to work?
Yeah, it is such a challenge right now because we don't just have the health challenge before us, but we've got the economic challenge before us. And there's so many folks that I know that are out there in small business, whether it's the local cleaners or the restaurant or the fellows working on your car. I mean, just so many people who are having such difficult time right now. And that's why I believe you're seeing governors across the nation try to figure out how we do this in a responsible way, because you got to make certain that you address the health challenge, and goodness knows we've done an awful lot in that area. Although because this is a new infectious disease, the public's following this in real time, which is extremely unusual. Mm-hmm. Usually with a new infectious disease, and we get them often. What happens is that the scientists and the doctors follow it until they figure out exactly what can be done to solve the challenge. And the public rarely sees the fits and starts of the trial treatments, of the trial testing, and the like. But now the world is following this in real time. But it's going in a logical, methodical way. And what folks want to know is what's going to happen. And the problem is that with a new infectious disease, you don't always know exactly what's going to happen. And that uncertainty causes problems not just in the health arena, but especially in the economic arena.
One of the things that's concerned me is the goalpost move, because when we were sold on this shutdown, and it was reasonable at first because no one knew, as you say, Dr. Price, no one knew what this infection was, how bad it could be. So we were sold on it by saying we don't want to overrun our healthcare system. We don't want to overrun our beds. We don't have enough ventilators. We don't want doctors like yourself having to make decisions on who to care for and who not to care for, like they did on the battlefield of the Civil War. Nobody wanted that. So everybody got it. Okay, shut down April, 2 weeks, 3, whatever it takes. But that's gone. I mean, the hospital systems aren't overrun. We have many more beds available than we're ever going to need. Hospitals are empty. We're giving ventilators now away. Then they said we had to flatten the curve. Well, the curve is flattened. Now it's testing. What is the purpose of testing? I mean, I could test today, Mr. Secretary. I could test negative. I could go and buy a cup of coffee at McDonald's, put my hand on the coffee or pump gas, pick it up. So do I get tested like every single hour in perpetuity? Why does this matter?
Yeah. No, you pointed out some extremely important issues. One is that the capacity issue of the healthcare system. And you're absolutely right. The reason to mitigate initially, the reason to have the physical distancing, the reason to have the isolation was to prevent that remarkable increased spike that happened in a few communities. But certainly that we watched in Italy, for example, that then overwhelms the healthcare system so that you can't even make any decisions about what people need to have done for them because you don't have the capacity to be able to care for them. And that was a real concern and a real fear. And we're past that. We're through that because of the education of folks, the appreciation for this physical distancing, the appreciation for no longer shaking hands and hugging like we have done in the past. And as you say, the hospitals are empty. And if there's ever a place to begin to start to get the economy back rolling again, it's at hospitals where folks know exactly what the sterile procedure is and how to protect themselves and how to protect their patients. And as you say, hospitals are empty. There's a hospital system close to Atlanta here that has a couple hospitals with 500 beds, and the other a week ago there were three patients in the whole hospital. And so you've got to get things back moving from an economic standpoint, but that doesn't just mean that testing needs to be available, because it does. Folks need to know where they stand, but it means that consumers have to have confidence that when they go out and purchase goods and services, that they're not going to be exposed unnecessarily to a health risk. And it also means that businesses need liability protection so that they don't have to live under the threat of somebody getting an infection when they're out and about, and then blaming it on them for no fault of their own, even though they were taking all the precautions necessary. So there are so many different variables in this equation that it doesn't surprise me that we're still having significant challenges out there from an economic standpoint, because folks, again, sense that uncertainty on all sides.
Congressman, you think the Democrats are weaponizing this politically?
Well, I think some folks are, without a doubt, but when I served in Congress for over 12 years, most individuals wanted to do the right thing. The challenge was trying to get the critical mass together to do the right thing. And then you've got folks that are so-called leaders that make it so difficult to move forward as a group of individuals who are charged with making these decisions. And we're in such a partisan environment right now that one person says white, the other person says black, one person says yellow, the other person says green, one person says day, the other person says night, and it just doesn't make any sense. But that's where we find ourselves right now. You notice today or tomorrow the Senate's opening, but the House isn't coming back yet, and they may have very good reason not to do so, but it makes it extremely difficult to move forward.
Well, the other thing is, how do you tell people to get back to work and be productive when Congress, which is their job is to convene in a crisis, don't want to come to work? I don't really get that. How does that work?
Well, that's leading by example. But I suspect they would say, look, it's not safe yet. The House physician, the attending physician in the Capitol, felt that they weren't able to do so safely. The House is a little different. There's no doubt about it. It's got 435 folks gathered into one room. The Senate, for all their activities, they can space out individuals coming into the chamber and the like much differently and much more efficiently, I think, probably than the House. But you're right. Folks have to get back to work, and we need to just pray and hope that individuals will make the right decision and move our nation forward together, making progress together.
John Fredericks Radio Network, Trucking the Truth Across America, live today, tomorrow and Wednesday in Clarksdale, Mississippi, and the Mississippi Delta, Thursday and Friday. Our Open America Tour goes to Tennessee. We'll be in Nashville, where with Secretary Tom Price, former Secretary, the 23rd Secretary of the Health and Human Services Agency in the United States, cabinet member, Trump administration, also long-term congressman from the 6th district. That's where I lived in the area of Georgia, which is the North Atlanta suburbs. A long-term friend of mine, Truth in Advertising, and he's been great to me and my family for a very long time. And you were a great congressman. I'll tell you the other thing when I was there in the 6th district, and you were getting 75%, 72%, 75%, and now it's a swing district, right? It's right in the middle.
The world has changed, John. The world has changed.
That's not the best answer. Mr. Secretary, you said one thing that I really want to focus on, and that is the same thing that Mitch McConnell said. And I've been critical of him for a long time, but I think recently with how he's handled judges and the way he's handled some things, I've actually been very complimentary of him. But he said the same thing. He said, we can't go forward with any more stimulus package or bailing out states or anything else if we don't have complete blanket liability for businesses. When I was in Georgia and I talked to restaurant owners who didn't want to open, they were saying, they didn't know how to get their people in because of unemployment. But everyone said to me the same thing. I can't take the liability risk. I don't have enough resources to fight lawyers and class action suits if somebody gets sick. So I'll get wiped out. So I just can't. I just got to wait till that's figured out. What would your suggestion be, Mr. Secretary?
This is incredibly important, and it's a pretty simple solution, I believe, and that is that the state define a list of parameters, a list of criteria, metrics that can be easily determined. How many people in a place, whether or not there are masks worn, what the distance is, how often something is cleaned, etc. And then the business owners can make a decision about whether or not they're able to comply with that. And if they're able to comply with that, and there are relatively easy metrics to be able to determine whether or not they have, then they ought to be given immunity, not from anything, but from an individual catching an infectious disease, that they can't be sued for that. So this isn't about whether or not somebody's being reckless or ignoring all of the rules or all the protections. This is about honest, hardworking folks who are running a business, who are trying to do the right thing, who are trying to comply and do comply with whatever the dictates are from the public health department in their state, and still there's a risk because again this is a new infectious disease and you just don't know how it's transmitted completely, and even if you do all of the right things, it can be transmitted. So they need liability protection. I think the best place to do this is at the state level, although it could be done at the federal level through OSHA standards or the like, and that may be something that Washington would address. Although again, the partisan nature of the town right now makes it so that that's highly unlikely.
Why would Democrats be opposed to blanket liability insurance so businesses can reopen and people can get jobs? Like, why would they be in opposition to that?
Well, the leadership of the other side is oftentimes beholden to the people that support them most strongly, and one of those groups that supports them incredibly strongly is the trial bar. And we see this in every state. We saw it in Washington, and it continues to be the case. That there are a group of trial lawyers, not all, but a group of trial lawyers who are not interested in reducing liability from anybody, and they make a convincing argument if you listen to them just on the surface, and that is that nobody ought to have to risk getting an infection if they go to a business establishment. And in an ideal world, that's correct, but in the real world, what happens is that there's no way for there to be absolute certainty that an individual won't pick up something somewhere. And then at the same time, if an individual goes to 3 different establishments and then they get sick 3 days later, how do you know that it was at one of those establishments and not on their walk in the neighborhood, or get it from their child or whatever? But the challenge for the business owner is, as you mentioned, defending themselves in a court of law and having to spend all of those resources to defend themselves, and it's just not worth it for so many of them because they're on the edge right now as it is.
Well, that's what some of them said. It's like, I don't have any money now, so I don't have everybody's got liability insurance and they have lawyers, and you have to have some money for that, but it's like, I can barely pay the utility bill, let alone rack up lawyer bills now, and so it's just going to
That's
put
right.
me under. So I just can't take that risk. So I'm just going to stay shut. I mean, it's crazy. One
Yeah.
guy that I talked to that's not opening his restaurant, I think it was in the Alpharetta area, North Fulton. You're familiar with it. He said, I can't open because the restrictions are such that I've got the government telling me how many tables I can have, how many people I can serve. And he said, my business is based on turning so many tables an hour. I would have to change my entire business and bring all kinds of different people in, everything would change when I got the government dictating to me how to run my
Yeah.
business.
Yeah, yeah, and that's a huge conundrum because most of these service businesses, like restaurants, especially, I mean, they need to have a steady flow of folks coming through their establishment in order to keep the lights on, pay for the ovens, pay for the food, pay for the supplies, pay for the workers, pay for whatever it is. And their business models calculate that very specifically. And people make a decision about whether or not to go to a restaurant that may seem to be more crowded than others, and pay that cost. But if you change that whole business model, that makes it extremely difficult for the especially those small businesses out there that are just having a huge challenge, just trying to make ends meet right now, and surviving, not just make ends meet, surviving.
All right, you're on the John Fredericks Radio Network. Got a couple more minutes. We're with Dr. Tom Price, former Congressman, 6th District, Georgia. That's the North Atlanta Fulton suburbs. Most recently served as the 23rd Secretary of Health and Human Services. So, Secretary Price, couple more questions. Have you backed anybody in the upcoming U.S. Senate race in Georgia?
Well, we've got two races, and I'm supporting David Perdue, who is the incumbent, as well as Kelly Loeffler, who's the incumbent on the other side, was appointed by Governor Kemp earlier this year, or maybe late last year. So we've got great folks up there working hard, and hopefully we'll be able to keep Georgia as red as it can be.
Well, let's definitely hope for that. Hey, final question that I was thinking about last night when you were Secretary of HHS. Did you work at all with Dr. Fauci? Because he would have reported up to you, indirectly through NIH or something. Did you know him at all? Did you spend any time with him?
Yeah, I did. Absolutely. Dr. Collins, Francis Collins, is the head of NIH, and then Dr. Fauci works under Dr. Collins there, and we didn't spend a lot of time together, but on a number of occasions had the opportunity to work with Dr. Fauci and kind of glean his wisdom and his experience. One of the things that I was able to do is I participated in the first G20 Health Summit in Geneva in the summer of 2017, and I was surprised actually that it was the first health summit that the G20 had held. And curiously, one of the things that we did, we had a blue sky activity, which was kind of a trial on how to handle a pandemic between all of the 20 most advanced countries in the world. And it was a fascinating experience. And one of the things that we did in preparation for that was to talk about what the capacity that we have in the United States was, and what we would do. And in that activity and in others, I had the opportunity to work with Dr. Fauci.
Were you happy with his
These are
work?
dedicated folks. These are dedicated folks that are working
Right.
as hard as they can to solve this challenge, I tell you.
All right, Mr. Secretary, we're out of time. I really want to thank you for joining us today. Let's hope we get these states open.
Well, I would just ask folks to try to be cooperative and work together. All the governors are trying to make the best decisions that they can, given the information that they have. And I know that's the case with Governor Kemp here in Georgia, and he's taken a lot of hits in the press, and it comes with the territory. There's no doubt about it. But again, this is a new infectious disease. There's no way to be absolutely certain with any decision that you make on any side, whether you lock everything down and shut it for a year, or whether you keep everything open. So you just have to be patient with folks and understand that they're trying to make the best decisions possible.
Mr. Secretary, thank you for being with us today.